A lot of information in this presentation, and I know that the title is a little bit vague as it relates to sort of just general sleep industry updates, but I hope that you'll appreciate there's a lot of information here. I don't want any of this to alarm you or to be frightening that, am I going to have a job in 5 years or anything like that, because this is just innovation and tools and things that are going to help us from a diagnostic perspective, but then also to help patients who have sleep apnea and help those patients achieve some level of relief from their sleep disorder. So Robert Miller, I've been a part of the Carolina Sleep Society. We were sending text messages before the meeting this time trying to come up with how long we've been involved with the Carolina Sleep Society. Has anybody in the room been involved with Carolina Sleep or coming to the Carolina Sleep meetings before 2007? All right, so we've got a few. The very first one. Awesome. We got some OGs in the house. So I've been on the board of the Carolina Sleep Society in some form or fashion since 2007. In my full-time career, I'm the vice president of sleep with Apria. And I also have a podcast. If you haven't listened to it or haven't had the opportunity, maybe you didn't know about it, I would encourage you to check it out. It is intended for those of us in sleep. It's not, I know that the American Academy of Sleep Medicine has a podcast. It's really geared toward physicians. This is more for us, and so that's the purpose of Sleep Tech Talk. It's available on all podcast platforms and also YouTube. If we're not connected on LinkedIn, I've got a QR code here. Please feel free to connect with me, and I'd love to, participate and have you see some of the things that I'm able to share on LinkedIn. And I post very frequently because I want to make sure that as many of us as can stay connected and are up to date on the things that are sort of new and exciting in the world of sleep medicine. All right, I don't see any more phones up there. So some of the things that we're going to talk about are, sort of, especially on the diagnostic side and then on the sleep therapy side, are just some things that is sort of the past, present, and future of sleep medicine. So let's start with sleep diagnostics. And there are a few topics that I'm going to ask you specifically to take notes, because I want you to, we won't spend a lot of time sort of going through the science, but I want you to understand the terminology and the technology. Like I heard a few questions that was asked yesterday, and it's not condemning in any way, but it was a little bit alarming to me that some of you had not heard of some of the new technologies that are out there, because you may be even using it in your lab today. So I want to make sure that you know about it and you understand what it is, how it works, and then how you can use it to more effectively diagnose and treat your patients. So if you look at sort of the evolution of sleep diagnostics, we know about in-lab sleep studies, of course. It's funny to me because I have been around long enough, and many of you have too, that there was certainly a time when home sleep apnea testing was not something that was considered to be a long-term viable part of our industry, but here we are, right? But some of the new generation tech and some of the things in the future that could potentially help identify patients who have sleep apnea and do it easier and maybe more, not necessarily more effectively, but certainly easier and have a wider swath of patients that it's able to connect to. There's wearables. If you walk in the vendor area, there's a lot of companies. They weren't here 3 or 4 years ago. They weren't in existence, even a year ago. We have Huxley Medical, who's here. This is the first sleep conference that I think that they've done, other than the National Sleep Meeting back in June. So this is the first regional meeting that they've done. Even some of the traditional diagnostic companies like Compumedics have some of the newer technology that's becoming more patch-based and seems a little bit closer to some of the wearables. Has anybody seen the information recently about the Apple Watch being FDA approved for sleep screening? So how do we apply that, right? How do we take that technology and apply it to what we do? We'll talk a little bit about that. Smartphones and no contact monitors. Has anyone heard of, and I actually have it in another slide, has anyone ever heard of Resonea? So there's a company called Resonea that has a smartphone app that has an FDA approval for screening for sleep apnea. So that's what the purpose of this conversation is today, is just to make you aware of some of these different diagnostic tools and things that are out there so that you can do your own research after you leave here. So take lots of notes. What about some of the wireless radar-based sleep monitoring systems? You know, can you imagine a day and time when we maybe have something that just sits right on the nightstand and provides physiological data on a patient who has a chronic condition in the home, no contact, but is able to gather that information? I think that would be powerful in the long-term care of a patient. We talked about remote therapeutic monitoring yesterday, right? So think about the front end of that is some of this technology to help facilitate that remote therapeutic monitoring. So this is an interesting one, and I am going to spend a little bit more time on some of these as we go through. Biomarkers. Biomarkers would be a blood test. There are, and I'm going to show you a clinical study that you can take some notes on and go back and look up the clinical study that will show you that there are certain biomarkers in blood tests that you can identify patients who have obstructive sleep apnea. So imagine a patient who is a new patient who thinks they have diabetes, which they have to go get some blood tests done, and you add one more panel to that blood test, and now you have diagnosed that patient potentially as having diabetes and sleep apnea, and you treat both conditions at the same time. It's one of the things I think that we have sort of picked up on recently in my line of work is that patients who have diabetes, we know that a lot of patients who have diabetes have sleep apnea, and a lot of sleep apnea patients have diabetes. But there is very little coordinated care as it relates to those two patient populations. They get diagnosed at different points in their sort of health journey, and it may be a PCP who identifies the patient as having an issue with diabetes, and it's that PCP who treats the diabetes, but they don't necessarily think about sleep apnea. VM pill. So there is actually a pill that you can swallow, and as it passes through the patient's body, it collects multiple physiological data parameters. So that's something for you to take a look at. AI facial scans. I actually posted something on LinkedIn not too long ago about this, and it was actually an article from a few years back where it was a potential new technology that would do a facial scan on a patient and then use AI to identify if that patient might, just from an anatomical perspective, have obstructive sleep apnea. And then what about the potential of just having AI do an analysis of a healthcare system's EMR and identify patients who might potentially have sleep apnea that just based on their other medical conditions? Y'all are quiet. All right, let's talk a little bit about home sleep testing. So we know that the Apnea Link Air was around for a long time, and unfortunately that one is sort of old school. And then with the Philips diagnostic, the Philips Night 1, we've seen that one around for the last several years, but unfortunately it's become obsolete because they don't sell it anymore. So we have the new school technology that's on its way. Anybody using sleep imaging? Nobody. All right. There's also some newer technology today that actually works with, and this is not an InsoData commercial, but I will talk about InsoData some during this presentation because of their new InsoTST product, which can take an FDA-approved oximeter and turn it into a home sleep test. What about Night Owl? It sort of started all of this sort of craziness as it relates to small, even in some cases, disposable home sleep testing devices that can transmit the data through an app to a cloud-based software. Anybody using Night Owl? No. All right. We've got only one. So Sansa, this is Huxley Medical's device. If you happen to stop by the Huxley Medical booth, you would have been able to learn more about this particular product. That what's interesting about it is one patch, it fits on the patient's chest, and it actually has an EKG. So it's not taking the pulse rate from an oximeter, it's taking the pulse rate from an actual EKG lead. And then Compumedics, they have their newest home sleep testing device as well. So you can see that these things are getting smaller. They're getting, in some cases, disposable. The good news is it's going to give us the ability to be able to diagnose patients faster and more easily when it comes to home sleep tests. Now, this is a good thing, but it's also a bad thing. And I'm not going to steal the thunder of Mark's presentation in a little bit. But I think that potentially using some of these types of diagnostic tools, because they are easier, it prepares a patient less for CPAP therapy because they're not as educated about the process. They're not as engaged in the process because it's a lot to spend a night in a sleep lab. It takes a commitment to, go away for the night and have all of these leads placed on you. It feels like a big deal, right? But if you send me a ring and tell me that that's what I need to wear, and I'm going to have, and it's going to tell me that I have obstructive sleep apnea, I may not take the therapy quite as seriously. So it means that we need to do a better job of using these tools, but also educating the patient to make sure they understand that, yes, this is an easy way to understand what's happening to you, but the treatment is still something you have to be committed to. Did somebody say amen? All right. So WatchPat. Everybody knows WatchPat, right? So WatchPat is peripheral arterial tone. It measures the arterial pulse volume changes in the finger as a result of vasomotion, vasoconstriction, and vasodilation, right? So let me ask you that question. We've known that WatchPat has been out for several years, but have you taken the time to really understand what the technology is around the WatchPat device? So when you leave here, again, take notes. When you leave here, spend some time doing some research on PAT technology and understanding what it is, how it works, and then how it's different from PPG. We had a couple of different people who talked about PPG yesterday. So all of the other home sleep testing devices, for the most part, that are not a WatchPat will use this PPG technology. So you can see that this PPG, and by the way, the PPG is using an oximeter. So you can get all of this data because it's detecting the changes in blood and peripheral circulation. And it uses that data to pull out sleep, oximetry, heart rate. It's getting all of that information. I put this slide in the presentation, and this will be available online after the conference, by the way, because I wanted you to see that this PPG is a sophisticated algorithm and a sophisticated technology to be able to take a very simple diagnostic channel, if you would, and derive a ton of information out of that single source of patient data. Sleep image actually also uses another technology called cardiopulmonary coupling. So the three things we're going to take away from this home sleep testing, this part of the home sleep testing discussion, is that you need to look up and do some research on PAT technology, PPG technology, and cardiopulmonary coupling. So with sleep image, for instance, it's interesting because it's not their device that's FDA approved for sleep apnea. It's their software. And in fact, their software is, I think it's the only one that has FDA approval to do pediatrics as well. Here are some of the disruptors. Is there a chance that in the future, consumer grade technology, sleep technology, could displace healthcare grade standards of diagnosis? So we know that Apple recently made their announcement. They got their FDA approval. But did anybody know that Samsung already had it since the beginning of the year? So now we're talking about, consumer technology. And then the other thing that I was pretty surprised by, it's hundreds of thousands of Apple Watches that get purchased every year. So the fact that we have all of these people who are walking around with a little diagnostic tool on their arm is something in the future I think that we have to take advantage of. And the interesting thing is that if you start to look at some of the newer research on these products, it really has sort of crossed the threshold of being consumer grade versus healthcare grade. And there, at one point, there was a significant difference. The quality of the oximetry technology was nowhere near what you would get if you were using like a Masimo or a Nonin oximeter. But I don't know if you saw it, but earlier this year, Masimo actually successfully was in a lawsuit with Apple. And they were able to get Apple to pull their oximetry technology out of the Apple Watches for a period of time. And Apple eventually settled with them so that they could continue to have that oximetry back into the Apple Watch. There's also a company to keep your eye on. It's this Withings Health Solutions. They're interesting to me because their technology is, it is a technology that doesn't touch the patient, but it's this pad that actually goes under the patient's mattress or under the sheet, and it's able to collect physiological data on the patient. It also has FDA approval to screen patients for sleep apnea. Is this neat? All right, good. So here's a couple of companies I think that are extremely interesting to me because this is where sort of the home medical equipment world, the consumer technology, and then even healthcare platforms sort of all merge. So these two companies, I recently had the opportunity to meet with this company called Rook, and they basically take Apple Watches, CPAP device data, anything that can connect to a cloud platform, and they aggregate it so that a patient goes to one place or a provider goes to one place and is able to see all of the touch points. I'll give you another patient population, CGM. Most CGM devices do connect to some type of app so a diabetic patient can monitor their diabetes, right? So Rook is a new startup that's starting to they're starting to develop those types of integrations and relationship. But this company, Human API, they are well ahead of where Rook is. You can see they have 30,000 plus health data integrations already. Can you imagine a single platform that is connected to your Apple Watch, but it's also connected to your hospital's EMR? And it's also connected to your CPAP device and your scale. That is, I think that is a pretty powerful way to manage data, and a little scary too. So the future for us is, can we bring the sleep center to the home? Did anybody stop by the Onera booth? It's incredible technology. There's 3 companies that I'm aware of today that have the ability to deliver a level 2 test. It's Onera, there is Cerebra, and then Knox also has a system that will do a sleep test in the home. Anybody recognize that house in the no? Where'd it go? There it is. Yes, it's the house from the movie screen. All right, so here's the imposters. If you go to Amazon, you can look up home sleep test. I mean, holy smokes, all this stuff that's on here. How do you tell what's real? I mean, if you're a patient who's really trying to be an educated patient about the process of getting diagnosed for sleep apnea, and your doctor, you go to the hospital and they tell you it's going to be $900 for a home sleep test, but you go on Amazon and you can get it for $59. What in the world? Well, hey, to me, I don't want to order my healthcare off of Amazon unless it's a really good deal. So I talked a little bit about Resonea earlier. Their product, the app itself is called Drowsel. And Drowsel is to think that you have an app that you have to get a prescription for is interesting. But Drowsel and Resonea as a standalone company was sort of floundering. So recently, InsoData acquired the Drowsel product, Resonea. So if you take the things that InsoData has been bringing to the market from an AI perspective, think about the fact that they can take an oximeter, turn that into a home sleep test. And now they just added a product, an app that, and by the way, that app uses sound to be able to detect the patient's sleep apnea. So it's using using sound waves to detect the patient's breathing during the nighttime. I actually had an opportunity to test the Drowsel app myself, and I wanted to play a little bit of a trick on it. So at the time, I was wearing CPAP, and I wore my CPAP that night because I wanted to see if the Drowsel app, if it disrupted it with the sound of the CPAP, and then, you know, is it going to give me some crazy high AHI? Well, you know, the interesting thing is that the next day I did a download of my CPAP, or I looked on AirView, and the AHI that the Drowsel app produced was exactly the same as my CPAP. So it was extremely accurate. So what are they gonna do with all of that? I don't know. I'm just telling you about it. Biomarkers for OSA. I talked a little bit about this earlier. One of the things that I wanted to mention is when you start to do some research on these biomarkers for sleep apnea, you'll see some pretty heavy hitters in the world of sleep medicine that have been a part of doing the research. Dr. Dennis Wang, who's the medical director for Kaiser Permanente Sleep, was a part of this particular research study. And then also Dr. Richard Bogan out of South Carolina, who's a legend in the world of sleep medicine. You can see, I think when you start reading this particular clinical study, you really start to see how easily, how easy it would be to start to identify these patients, through a simple blood test. Because a lot of the things that are exacerbated by sleep apnea would certainly, from an endocrinology standpoint, would show up in a blood test. Why do we need these alternative diagnostic channels? Is anybody booked out at your sleep lab? Yeah. So I spoke with a hospital system recently, and it was 12 weeks to get a home sleep test. And you know what? I've made that comment in a few sleep conferences recently, and I saw some people going, well, that's not that bad. What do you mean it's not that bad? If I tell you that you have a potential life-threatening condition, I have to be able to diagnose you sooner than 12 weeks. It's just not fair to the patient when there is the ability to do it faster and do it better for the patient. Now, I don't want to take away, I absolutely don't want to take away some of the things that Christina talked about yesterday, by the way. And it was why I wanted her to come and talk about the emergencies in the sleep center. And I think it's because we can't necessarily take our eyes off of doing a great job in the sleep lab. And I promise you, all of the things I'm talking about, it seems like, this technology and AI and those sort of things, those are for the patients who are non-complicated. The patients who are complicated, they need to go to the sleep lab. And we need to pay close attention to those patients. We need to be prepared from an emergency standpoint. And I think the thing I took away from her presentation primarily was you need to practice the emergency things. We probably don't do that as an industry enough. So, think about this in your particular sleep lab. One of the things that I would promote and advocate for is that if you don't have a triage process, meaning that when you get a referral and you know that your in-lab studies are booked out, number one, expand your home sleep testing program. But then more importantly, triage the patients and the referrals that are coming in so that a non-complicated patient that was referred for an in-lab test, even if Medicare pays for it, or even if the payer will cover it, it might be the right thing to have that patient take a home sleep test home so that you can get a patient who's waiting on your backlog that really needs to be in the lab, in the lab sooner. You can say amen again. All right, so here's another potential opportunity. Now, if you're in an independent diagnostic testing facility or a physician-based practice, it might be difficult to consider outsourcing some of your home sleep testing. And you don't have to outsource all of your home sleep testing. But what if you at least consider the idea that we want to expand our geography beyond the people who can physically drive in and pick up a device and bring it back the next day. And now you've just opened it up. Now you have a mail delivery option for your patients. So you've expanded your geography, you've cut your backlog, and you don't have to worry about the inventory of the equipment. So that was enough about diagnostics. So let's talk about some of the new therapies and old therapies. We know about CPAP. We know all of the different ASV, AVAPs. We know about all of those things. Oral appliances, positional therapy. Some of the newer things that are out there. Inspire, of course. I think Inspire has probably done more for the sleep apnea industry and for all of us than we generally appreciate. How many people have seen ads for Inspire? Now, the only downside is that most of the time, I think patients who initially engage with, oh, I can go to bed and just, click the button and I go to sleep, right? Why are y'all laughing? No. I think the problem is they don't understand the full process that it's going to take to get them to an Inspire at some point. So it's a little bit of a journey. And I think even the Inspire folks would absolutely admit to the fact that it's probably a little more difficult journey than a patient or even some of us can appreciate in trying to get the patient through all of the hoops that they have to get to. Like I know that their website, they get 45,000 patients a month that will sign themselves up as being interested in Inspire surgery. 45,000 a month. UPPP, that's a surgery that's been around for a long time. It's not utilized so much anymore. There's radiofrequency ablation where they essentially go in and sort of cauterize some of the tissue in the posterior airway. Respicardia. I know that most of us have probably been involved or had some engagement with Inspire, but have you participated or been a part of the Zoll Respicardia product? It's fairly effective in treating patients who have central sleep apnea. The problem is that they have not had the ability to gain the payer coverage that Inspire has. It's probably the most incredible thing that I would say about Inspire is that they've been able over the course of the last several years to significantly engage with payers and get coverage for their patients and for their product. There's also a surgical procedure called airlift. It's a hyoid suspension. I have a little diagram to show you what that looks like in just a few minutes. And then the emerging therapies, I'm going to cover those in a little bit more detail. So the past. So how did you change the pressure? If you look at the old guy there with the CPAP machine in front of him, how did you change the pressure on that machine? Absolutely. A water column manometer. Some of y'all don't know what that is. And a screwdriver. You had to pop the little top off the tower side and adjust a little dial to change the pressure. So that's sort of the past. The present is, of course, the AirSense 11 device. We've got React Health's unit. And there is a third manufacturer that does have some presence here in the US called ResVent. And if you've ever used or seen one of those, it looks like a little ventilator. Like you turn it on and the lungs are expanding and retracting. It's kind of interesting. Anybody stop by the UL booth, by the way? Like that's a CPAP manufacturer that came to this conference that is not even FDA approved yet because they want people to know that they're coming. And actually, that's their CPAP right there in the middle of the screen. There are currently 7 manufacturers that have a CPAP device that is in for FDA approval right now. So yes, it means that there's going to be more manufacturers, more products, more devices that are coming to the market. I hope that it helps to create a healthy competition and that patients will benefit from the result of these additional entrants into the market. So I want to talk a little bit about some of the different therapies because it's not just necessarily that there are these new CPAP devices that look kind of cool that are coming to the market. There's also different ways to be able to deliver CPAP therapy. So the University of Cincinnati, and by the way, if you listen to the Sleep Tech Talk podcast, you'll be able to hear the actual researcher who was involved in in the development of this product. If you look closely at the mask on the left-hand side, you don't have to have a seal with this mask. It literally sits on the outside of the nares, and it will deliver. It's a significant pulse of air, but it's interesting because it takes less air pressure to keep the airway open, and it is. And again, you don't have to have a seal with the mask. So Vortex PAP, that's on the horizon. It's really in, I would say, early stage clinical. So it's probably a couple of years before we would see Vortex PAP come to the market. And the reason that I use this particular example, even though it has nothing to do with the actual Vortex PAP, is that this is the vortex, those vortex rings is how the pressure is delivered. So it's not continuous. It is a pulse, but it's a rapid pulse that takes place. Kind of neat, right? All right. Did somebody say no? It is a bit of an oscillation, and actually the thing that I compare it to is that the current devices that are on the market use a technology called FOT. It's functional oscillating technology to be able to detect whether a device or a patient is having a central apnea or an obstructive apnea. Did you know that? So the CPAP device, and it's Philips and ResMed both have this technology or similar technologies that when a patient's airflow becomes flatlined or so there's no effort, the device will start pulsing to test the airway to see is there an obstruction there or is it a central apnea. So that's how the units are able to detect whether the patient. So when you read your AirView report or your Care Orchestrator report, you see that the device is telling you whether a patient has central apneas or obstructive apneas, and it's that functional oscillating technology that they use to detect the centrals. So KPAP therapy. Has anybody heard of KPAP yet? I am going to tell you that KPAP from especially if you're a respiratory therapist, because I think that KPAP sort of goes against everything that you've ever been taught from how PAP therapy and even I would say anatomically things are supposed to happen from a therapy perspective. So, with traditional CPAP today, it's a higher pressure when you inhale and a lower pressure when you exhale if you use expiratory pressure relief. With KPAP therapy, it is exactly the opposite. And I will tell you that I had the opportunity to breathe on this technology. Has anybody else in the room been able to breathe on KPAP? It is extremely comfortable, even at high pressures. I can talk to you if I'm on 15. So KPAP is slated to hit the market sometime mid next year, maybe I would say in the spring to summertime of next year. And to me, it's going to be a game changer. It's going to be a game changer in that I think that, and there's lots of other reasons why clinically you should consider it. You should get your physicians to consider the use of KPAP therapy, because there's a couple things. One, they have found that patients have less mask leak, and they do less mouth breathing when they're on KPAP therapy. So that's part of the clinical trial results. There's also another aspect of this is that the creators of this particular technology will tell you that we have created complex sleep apnea because we are over ventilating or there's over pressurizing these patients to the point that we're causing central sleep apnea. So this particular technology reduces the centrals that you would see with patients because it's delivering a lower sort of mean pressure and can still maintain the patient's airway. So stay tuned for KPAP. It's on the way. So here's another thing that's kind of interesting. There's a company out of Canada that has this new AI algorithm for auto CPAP. Now I think the pressure is still what we would call standard CPAP therapy. It's just how it responds and how it delivers pressure to a patient is very different. So pay attention to Novarest. This is not commercially available yet, but I know that they're close, and we'll see this potentially start to get into some of the CPAP devices that are out there in the future. I do think it's interesting too that the one of the I would say leadership team is a former executive who was part of the leadership at ResMed. Stealth. So this one is interesting too. So this is a new, I guess, CPAP development company or a CPAP algorithm that is being developed. The company doesn't even have a name yet. They just call themselves Stealth so that they seem mysterious, I guess. But they're developing an auto algorithm that, and for a respiratory therapist, I know you'll appreciate this, it's based off of work of breathing, not necessarily flow. Interesting, right? So some of the alternative therapies. Any questions on any of those, by the way? Yeah. Yes, that is what's it called? VCOM, yes, thank you. So if you haven't, has anybody tried VCOM? I think they were here last year and they passed out VCOMs at their table. So the VCOM is an adapter that you can put in line with the CPAP tubing, and it helps to change the force of it doesn't deliver less pressure to a patient. It just changes how the pressure is, I guess, engaged with the patient. It changes it from this sort of direct, forceful pressure to more of a disturbance. What's that? Yeah, it does. It changes the way the pressure is delivered to the patient with a simple little adapter. And they have found that patients are more adherent, less mask leak. So it does a lot of the same things, and it's really where the origin of the testing and I would say research for the VCOM is what produced KPAP. So y'all check that out. You should have some VCOMs in your lab. I mean, think about this. What if your patient starts mouth breathing during the nighttime and you go get a VCOM and put the VCOM in place and you don't have to put a chin strap on the patient? Amen for that, right? Well, listen, I know a doctor who will talk to them for all the time that they want to talk. If Dr. Noah, who presented here last year, he loves to tell the story of VCOM, so we just need to connect him with your doctor, and he is always utterly committed to being able to do some education. All right, so some of the surgical procedures from an alternative therapy option, we've got Inspire, and then we have Airlift, and you can see this high suspension procedure. Sort of think of that as a built-in oral appliance. You know, it's helping to keep the chin forward, and it's significant. Does anybody use an oral appliance, by the way? Oh, wow. So I personally have been able to move from a CPAP device to using a custom oral appliance, and I have to tell you, I sleep just as well with my oral appliance as I ever did with my CPAP device, and it's a lot lighter to carry when I travel. Now, I will say that the oral appliance industry is a little bit of an enigma to me, and it's primarily because I think it absolutely needs to be a part of what we do. But because of the dynamics of reimbursement, I think that's what drives the two sort of traditional sleep medicine industry in one direction and dental sleep medicine in another direction. Because does anyone have a dentist that's a part of your a regular part of your sleep practice? I see a few heads shaking. That's good. And I know that one of the problems too that can be an issue is that if you're in a hospital-based sleep center, your physician sends the patient for a CPAP device. The insurance is, for the most part, going to cover all of that. But then you have a patient who's non-adherent, and you try to do the right thing for them and send them to a dentist to get them an oral appliance, and they want to charge them $5,000, and the insurance doesn't necessarily pay for it. And even the way that those devices are billed creates some of this issue, because it's actually an E code, which means that that's a DME billing code. So it's not a dental billing code. It's not a medical physician billing code. It's a DME code to bill for a custom oral appliance. Anybody know that? One of the other things that's also interesting to me too is that, these oral appliance manufacturers, and I just put this up on the screen because I wanted you to be able to see that even in their world, it's challenging because ProSomnus, Panthera, and Somnomed have all three had financial problems over the last year or so. So it's something that we need. It's a tool, it's a resource that patients need, but it's hard to get it paid for. And these companies, in trying to advocate for their dentist and for patients, they're spending sometimes more money than they make. All right, some of the other therapies that are out there. Has anyone's physician used Excite OSA? If you think about a potential solution for a patient that's using this neuromuscular or electrical stimulation, it's a daytime therapy to treat a nighttime problem. So the patient wears that device for, I think it's 20 minutes a day, and they do it for a 6-week period. And the clinical results are that they will see their sleep apnea reduced. There's another device, it's not available yet, that's coming into the market. And I think this is an early stage picture, so don't think of it as this suffocating external device, but Symmetrics has this air sleep device that provides this sort of external suction that will help to maintain the patient's airway during the nighttime. I think they're in phase 3 clinical trials right now. But when it comes to the market, I expect it to be much smaller. The actual mechanics of it will be much quieter than the current clinical version. iNap. Has anybody seen that one? All right, so iNap, I tried it. I've never drooled so much in my entire life. It's I saw a few heads shaking. Somebody else has done it too, but it will help to pull. It essentially uses a simple small suction to pull your tongue forward during the nighttime to help keep the posterior airway open. And you know what? For a patient who can't use CPAP, they can't wear an oral appliance because they only have 3 teeth. Something like this has to be a potential solution for that patient. Zoma has come into the marketplace recently as an alternative positional therapy device. Does anyone know that Philips had a positional therapy device called Night Balance? It was commercially available for several years, and it's just, I know the whole idea around positional therapy is not always extremely popular when it comes to incorporating that into a sleep program, but it should certainly be part of your overall patient strategy and treating these patients. All right, so we're looking at some new things that are on the horizon. So Genio by Nyxoah. This is an external hypoglossal nerve stimulator device, and this will absolutely give Inspire a run for its money. This is a 15-minute office procedure to put the stimulator under the tongue, and then it's a disposable patch that the patient wears every night with a little electrical module that's connected to the patch, and then the patient activates it with their app. One of the interesting, so this is still in for FDA approval here in the US. It's already being used outside of the United States. I do know that they have already started to hire their clinical team and their sales team with Nyxoah. More importantly, I think what's interesting is that one of the investors in this particular product is ResMed. Do you think they think it works? Absolutely. Follow the money. All right, Cry OSA. We'll actually, I've already talked to a speaker who'll be here next year to come in and talk to us about this Cry OSA. Has anyone heard of cryotherapy? We're using frigid temperatures to be able to reduce tissue size. Cry OSA is they're in their phase 3 clinical trials right now. It's called Arctic 3, and the results have been I think pretty good so far for Cry OSA. So it's another treatment that's on the horizon. All right, I know that Frank talked a little bit about this yesterday, and I have to admit, I was shocked that people had not heard more about GLP-1s and their impact on patients who have sleep apnea. And yes, it is absolutely 100% weight related. this is it's so impactful, and I know that you know the name is Ozempic, uh, but Ozempic is not FDA approved to treat sleep apnea. In fact, none of those medications are approved to treat sleep apnea. Ozempic's not even approved for weight loss, by the way. It's only approved for diabetes. So if you start to do the research on these companies, Eli Lilly and Novo Nordisk that have the GLP-1 medications, both companies have two. Mounjaro would be one, Ozempic would be another, Wegovy, and there is a fourth one, Zepbound, that was introduced. So it's interesting because they essentially the same product, same GLP-1 medication that patients are able to take. If it's a semaglutide, those patients typically lose about 10% of their body weight. If it's a tirzepatide, those patients are going to lose closer to 20% of their body weight. And in doing so, over the course of a year, because they did clinical trials, Frank mentioned the SURMOUNT OSA study. It's significant to us in this sleep industry because what that showed is that for patients who take that medication, that after the course of a year, those patients have an AHI reduction of 50%. Okay, it's significant. But if you have an AHI of 30 and you're reduced 50%, you still have sleep apnea, right? So I don't think that this necessarily, and it's interesting because even ResMed has sort of changed their tune on GLP-1s. It was, they considered it headwinds, as an industry at one point, meaning that, we're going to have to fight against these GLP-1s. And now their messaging has completely changed. It's all about, these are tailwinds. We have never seen advertising for sleep the way that we're going to see it in the future when Eli Lilly starts advertising for Zepbound, which is going to have FDA approval to treat sleep apnea by the end of the year. So it's coming. But the good news is, just like with Inspire, I believe that more patients are going to become interested and want to seek treatment for the treatment of their sleep apnea based on this increased advertising and increased awareness. So, I think the good news is lots more patients are going to get tested. So if you're backlogged now, get ready because there's more patients coming. Now, the one that I think will have the most impact from a pharmaceutical perspective is this synergy that comes from Apnimed. Okay, so do your research on this one because this one is the magic pill. This has nothing to do with weight. A patient can take this pill and it's a 50% reduction in your AHI. And you take the pill every night. So do spend some time. There's a study that's the Mariposa study where you're able to look at the clinical results of this medication. And I think what's interesting about Apnimed is that they're well funded. They have people who understand how to bring a new pharmaceutical treatment to the market, and we will see them sometime next year. So for your mild to moderate sleep apnea patients, this might be all they need is to take a pill. I had the opportunity to meet someone who was a part of their one of their clinical studies, and she told me the story of a patient who it was a female who, apparently she didn't get the placebo because she took the medication, she was off of her CPAP, and her husband went to the mountains, and when she came back, she told this researcher, she said, it is the first time in 20 years that I've traveled without my CPAP and my husband didn't hear me snore. So she, so it sounds like it works. So it's coming. The other thing that is also on the horizon for us, and these are interesting to me because, and by the way, like with Apnimed, the atomoxetine that's an ADHD medication. And I think the roxabutanine is a urology pharmaceutical treatment. So they've taken a couple of different medications that have been around forever and found the right combination that helps to keep the patient's airway open. Respire RX and Inconex. These two companies are in different various stages of clinical trials. Again, these are pharmaceutical treatments for sleep apnea. Both of these are THC based. So it's interesting to me. And so for us as healthcare providers and who are part of this industry, to me, these are just more tools. I'm not worried about whether we're going to have more CPAPs in the future. I'm more concerned that the patient who can't tolerate CPAP, who might be able to take this pill along with their CPAP and have a lower pressure and be more tolerant of their CPAP, is going to be able to wear it long term. So these last two things that I'll mention, we're not, as an industry, we're not quite ready for this yet, but I want you to be familiar with the terms phenotyping and endotyping, okay? Because in the future, I think this is where we can use technology to be able to identify characteristics about a particular patient that would put them into a category so that we do a diagnostic on a patient, and based on the diagnosis and other criteria, we don't always send them to CPAP, because CPAP might not be the best course of treatment for a particular patient population. So phenotyping, if you're taking notes, make sure you document this one and do a little research on phenotyping in sleep. And then endotyping. This is the other side of the coin. In the context of sleep apnea, refers to identifying distinct underlying mechanisms that contribute to the disease. So phenotyping and endotyping. Our industry is not going to be complicated. It's going to be sophisticated in the future. We're going to diagnose faster. We're going to make therapies better for patients that they can tolerate. And we're going to have a lot of choices versus what we've had in the past, which have been limited. Patients have been unable to use it or non-adherent. And we're going to be able to successfully treat more patients in the future. And the future is now. Any other questions? Thank you very much. Oh, by the way, one more QR code for you. If you haven't listened to Sleep Tech Talk, this will take you to the website. We're available on all podcast platforms and YouTube. And if I can push you to watch YouTube, because we're getting lots of subscribers and lots of views. I think we're over 15,000 subscribers on YouTube now. Our last episode had 75,000 views. So y'all come check out Sleep Tech Talk. Thank you.